let me introduce Julie, who's a music therapist. I knew nothing about music therapy before I talked to Julie. Now I know a little bit, but today she's going to talk to us about music therapy, what it is, and particularly how it can help people in recovery, because she has worked with several of our tribe and we've heard glowing reports. So for some of you that like to try new things, you might be interested. She is based in Joburg. I'm trying to persuade her to do more work on Zoom, but I don't know if she's convinced yet because she does most of her work in person, but we'll see. So you'll have a chance to ask her some questions after she's done her talk.
Thanks, Janet, and hello, everybody. So I first contacted Janet in March last year, and I was looking for people who might be interested in experiencing GIM, which is guided imagery and music. And since then, as Janet said, I've seen a number of members of 𝐼𝐵, as well as other clients as well for GIM. I've given GIM to them. And I love GIM as a therapeutic intervention, and I've received positive feedback, but I've also noticed significant changes in the people that I've worked with. So I will hopefully be qualifying soon, but in the meantime, I am still taking on new clients at a reduced rate to fulfill my training requirements. So I am Julie, I'm a music therapist, and I'll be focusing on GIM today, but I'll also be beginning with speaking about music therapy because most people are quite unfamiliar with it. So music therapy is a psychological, psychotherapeutic clinical intervention where we don't just use words to communicate and express. We also use nonverbal techniques using music, but also other art mediums. So music therapy is accessible to clients with less emotional literacy, in other words, ability to put emotions into words, such as non-speakers or children and many others. We are arts therapists. In South Africa, we have dance and movement therapy, art therapy, drama therapy, and music therapy are all under the banner of arts therapies. And so our focus is creative expression, and it goes beyond using just music. And also as psychotherapists, we also use verbal processing where this is possible for a client. So when people imagine music therapy, they often picture someone playing music to a client who sits and absorbs the healing sounds. But music therapy is actually a very interactive process. And like other psychotherapy, it happens in the context of a therapeutic relationship. And sometimes a music therapy session may not even actually involve music for various possible reasons. Oh, I think we lost power, but we're still connected. So as music therapists, we are trained to attune to clients musically and to use music in various ways to develop the therapeutic relationship and to work towards various clinical goals. But the clients themselves are very active in this process and in choosing the goals as well. And this active and creative and sometimes fun nature of making music and also other art processes can be very motivating. And it can prompt more engagement from clients than may otherwise have been the case. So it can help people to experience themselves in a new and positive way. So music therapists are health professionals, and we're registered with the HPCSA, which is the Health Professions Council of South Africa. We have a clinical master's degree and training in psychology, neuropsychology, music theory and performance, music psychology, and other fields. So some of this is going to be is a repeat of what's in the podcast, but some of it is new. So we work with clients of all ages in prisons, hospitals, schools, psychiatric facilities, and more. We use music therapy with children with special needs, babies in neonatal ICU, elderly people with dementia, stroke and traumatic brain injury survivors, adults with mental health challenges, teenagers going through life transitions, but also just people looking to explore their creative potential and explore purpose and meaning. Music therapy is evidence-based and well-established in countries overseas, especially the UK, the USA, and Australia. And the body of research into music therapy with specific client populations and various approaches is growing all the time. I really like this quotation by Kenneth Bruscher, who's one of the researchers that I really love reading. And I think it really captures why I love my job so much, because it is evidence-based, but it's also grounded in the arts and creativity. And the experience of giving therapy also sometimes feels like an artistic process in a way. So maybe I'll just quickly read it out loud. As a fusion of music and therapy, music therapy is at once an art, a science, and an interpersonal process. As an art, it is concerned with subjectivity, individuality, creativity, and beauty. As a science, it is concerned with objectivity, universality, replicability, and truth. So in a typical music therapy session, I might use songwriting, composition, recording, music listening, active music making, which is generally improvisation, lyric analysis, voice work, movement to music, creation of artworks, painting, drawing, or working with molding clay. And just to say a little bit more about improvisation, which we use a lot, and we also use in GIM, which I'll explain a bit later. This involves a client actively making music with the music therapist, as an individual or also in groups. So the music can act as a container for intense emotion, and the improvisation involves inviting a client to express themselves through the music in real time with an instrumental voice, and then as a music therapist, attuning to and supporting the client musically. Improvisation can reveal relationship dynamics, and it can help with various things, including improving communication and self-awareness. It's also an exercise in tolerating the unknown, in tolerating uncertainty. It can be quite uncomfortable sometimes for people, but we go at the pace that people are comfortable with, and sometimes we don't do improvisation. Everything is very much individualized on the client or the group's needs. For those who have experienced trauma, it can be difficult to put their experience into words, so music offers a non-verbal alternative that still communicates a lot, or even sometimes more than words, about how someone feels, and can give someone the experience of being truly heard. However, no musical skill is needed to benefit from music therapy. Most of my clients have no musical training at all. We do believe that everybody is innately musical to a degree, which I'll go into a bit later, but we generally use instruments that are easy to use, such as percussion, melodic instruments with a limited number of notes, but we also use instruments like the guitar or piano, and we help and encourage clients to express themselves intuitively on these instruments while we frame their musical expression by interacting with them musically. At the moment, I have a private practice in Parktown, and as Janet said, I usually see people in person, but I am looking forward to see more clients online because I do quite a lot of driving, and I would prefer to do more work at my practice. I see adults, teens, and children. I also work in a mental health clinic and a school and a children's home giving group music therapy. And I have had experience in a rehabilitation hospital, in a frail care psychiatric hospital, and a shelter for women and children. So GIM is also referred to as the Barney method. And I have actually been receiving GIM myself for about 4 years now. Not very frequently anymore at the moment, but so usually sometimes every few months, sometimes half a year will pass, but in the beginning I went more frequently. And I think experiencing it myself has helped a lot in terms of accompanying others in their process. As I said, it's called the Barney method. It's a specialization, and it requires 3 to 5 years of extra training, additional training. And it uses carefully curated selections of music to support various kinds of emotional processing and psychological goals. For example, providing support, nurturing and strengthening, working through grief, sadness, frustration, anger, purposelessness, exploring life transitions, endings and beginnings, accessing and developing creativity, and also exploring spirituality. I think I want to just say that music preference is very important in music therapy, and we take that very seriously. But in GIM, we use very specific music, but we also are very sensitive to how the client is experiencing the music in the moment. And the client is likely to experience the music quite differently than they might just listening at home. So you might think, oh, I don't really listen to classical music, I don't really like it, or we don't only use classical music, which I'll explain, but you will probably experience music quite differently in the music therapy space because of how it's framed and how it's guided. So the GIM process itself starts with a pre-talk, which is where we just chat about what's happened in the week and what's on the client's mind. And then an intention is set. And then there's a relaxation or induction where a client is guided into relaxing into a deeper state of consciousness. The journey itself then follows when the therapist or the guide, we call them, selects specific music, and then the client narrates their inner experience as it unfolds. The therapist then asks questions or responds, and then lastly, when that comes to an end, the client will do some kind of creative processing. Usually it's drawing, but it could also be making music or moving, and sometimes that's decided in the moment or beforehand, just depending on the clients and their needs. And then lastly, there's an integration where the client and the therapist reflect on the creative process and the results of it. I ask questions, we explore deeper what it might mean for them, and then the client thinks about what insights they're taking into their week. And then, yeah, so that's the kind of full process that we go through. And just to talk a bit more about the journey itself, during a GIM session, you'll most likely see images in your mind's eye while the music is playing. And these form a kind of story or have symbolic or metaphoric meaning relating to your life and circumstances. Sometimes the imagery is from memories. And GIM is partially inspired by Carl Jung, who believed that the psyche makes itself known in imagery. The images we experience can be representations of self or our internal reality. And the experience can be compared to a kind of long daydream where the music is the soundtrack and the music is carefully selected to fit the therapeutic needs, as I mentioned. In a relaxed state, we have deeper access or more access to deeper layers of wisdom, insight, and knowledge. And the GIM process helps us to get out of a cognitive mode, which some people struggle with, just being very in their heads, and helps us to integrate our different parts of self, our head and our heart knowledge, and to feel emotions that may otherwise be quite difficult to access. So it's a holistic approach. And it helps us to become aware and work through patterns that no longer serve us. And to give a bit of a history of how the approach developed, in the 1970s and 60s, research was being done into psychedelic-assisted therapy. And Helen Bonney, who is the founder of GIM, was researching which music would best facilitate a therapeutic journey under the influence of psychedelics. When the drugs were made illegal, Bonney wanted to explore whether it would be helpful to use music alone as an intervention. She ended up concluding that it was, and that there are in fact many benefits to using music alone, most notably that it is a safer and gentler process and doesn't push the psyche too quickly, which could result in experiences that are difficult to contain. So GIM can be seen as an alternative to psychedelic-assisted therapy, which is gaining popularity at the moment. In my experience, GIM can actually facilitate very intense emotional experiences, but these are generally manageable because they are contained in the music and accompanied by the guide. And in the context of people recovering from dependence on alcohol, GIM can be very helpful in assisting clients to gently increase their tolerance for experiencing intense emotions and realizing that they can access their own innate wisdom. And it's important that we really go at the pace of the client. So if somebody is, as Janet was mentioning earlier, in quite a fragile state, we would not jump into a full program. We would do much smaller programs or even do other processes first to prepare. So everything is very much tailored to the client's needs and where they're at. And everything's also opted in, so the client has the choice to stop or express how they're feeling. They're encouraged to always express how they're feeling and experiencing it. GIM can help people to uncover new possibilities and new ways of experiencing themselves. It can also sometimes involve peak experiences or what we call transpersonal spiritual type experiences, where a client has a sense of themselves as connected to the universe or their place in the universe. It can be helpful in building a sense of self and rethinking our narrative, but also cultivating enjoyment of the moment and appreciation of beauty. Often the experience in GIM is, I often hear clients saying, oh, it's so beautiful, so beautiful. The music, but also the imagery that they're experiencing is supported by the music. Working through difficult emotions, as I said, and ultimately experiencing one's life as more meaningful and worth living. Psychedelic-assisted therapy is currently getting a lot of attention internationally and increasingly in South Africa, but it is difficult to conduct research as many of the promising psychedelics are still illegal. GIM is less risky in that the client has more control and can take the process at their own pace. GIM is also potentially preferable for those who've had difficulties in the past with substance dependence, and there's evidence emerging that there may be a risk for certain people to develop dependence on ketamine, which is the one that is legal in South Africa. So GIM has to be done by a therapist who's trained using various breathwork and grounding techniques, has closely studied and learned to use specific music programs and guiding techniques. And traditionally, these music programs, I should be putting this on slide mode. These music programs usually use classical music, but GIM is practiced in 34 countries, and new programs are being researched and added, but they go through a strict process to be added. So here's some examples of programs we might use. And so these are selections of music, and they happen generally in a particular order, but we also learn as guides to swap out music. And depending on how the client is experiencing the music, we might change to a different program or do something different. It's quite flexible, but it is very specific and designed on the basis of the musical elements, intensity, stability, predictability, which are all considered within these kind of emotional projects. So the next two slides are words from a client of mine who offered to share their art and reflections. In my still limited experience, I have seen clients really gaining confidence, developing self-awareness and self-acceptance, being kinder to themselves, feeling pride at their progress and insights, and feeling commitment to continuing their journey. So I do read this out in the podcast, so I don't think I'll read this out loud now, but just so that you can see the images. So as with any therapy, you don't need to be in absolute crisis to benefit from music therapy. And it can actually, and GIM as well, can be a helpful space for self-care, taking stock of your life and taking preventative steps so that you don't get to a point of crisis or burnout. Many of us already use music to help us feel better, and sometimes part of the music therapy process is just building those resources or reminding clients of their resources that they already use. As I mentioned earlier, I work in a mental health clinic and I give groups, and some of my clients are recovering from dependence on substances, and there's also just general psychiatric clients. So this is some of the feedback that I've gotten from those groups. I realized I can have fun without drinking. I don't feel so alone. I realized how important it is to be playful. Often the music therapy sessions leave clients feeling quite grounded. It helps them to really focus on the current moment and not run away with their thoughts. I love it when clients decide to return to music, or they remember what a role music played in their lives. They often talk about feeling connected to their inner child, and very often there's a very significant shift in mood from the beginning of the session to the end, where clients come in very depressed and then they leave singing and joking and chatting and very cheerful. So I often speak to patients about using music mindfully, because we all do experience music very differently. For music therapists don't just prescribe a song to everybody. This is the healing song. because of our different listening histories and our different sensitivities, and someone was mentioning earlier, just not feeling like listening to some music, it's too nostalgic, it might be triggering. So I really try to keep that in mind, and it means group work can sometimes be quite challenging because I have to really take into consideration so many different people's states and needs. But somehow it always works out and we find common ground. But people do have strong associations with music and with a particular time in their life sometimes, for example, associating music with partying. So this can make them feel anxious about listening to particular music, and it can also sometimes bring about overwhelm, emotional overwhelm, or fear of cravings coming back. So it is important to just really be mindful and careful about the music that you listen to. And working with a music therapist can also help you to, what someone once spoke about as rehabilitating songs, or in a way rewriting what they mean to you, which is possible. And in these groups, I really find that even clients who express finding music quite difficult to listen to or feeling quite low generally really benefit from connecting with others in the music. And the therapy space does, as I said before, bring about a bit of a different experience of the music. So Janet, I see we're coming for 5. Can I keep going for a bit, or should I wrap up?
I'd love to switch to Q&A actually, because I'm sure some people have got questions. So if you wrap up now and then stop sharing your screen, I'm going to put us back to gallery view.
Okay. So as music therapists, we have quite a wide definition of music because, as I said, we believe that everybody is innately musical and capable of expressing themselves musically in a certain sense. Music therapy is rooted in an understanding of how development as human beings and our capacity to relate has musical foundations in the communicative musicality between mother and infant. So I really think that Oliver Sacks is right in saying that music, at least understood in this broader sense, is part of what it is to be human. And music therapy really honors this part of our humanity and can help us to feel more like ourselves. One of my clients once admitted that they had tried music therapy just on a whim because it didn't sound like a real thing. So I hope that today I've relayed that it is a real thing, and I hope that I've made you curious to try it one day.
Oh, thank you, Julie. Thank you.